Hey everyone, this is Derek with Orthopedic Physical Therapy Products, and thank you so much for joining us on this Next Level Content Education Series episode in collaboration with EIM Evidence in Motion. Today I'm joined by Sara Owens, who is really going to talk to us today. Our topic of focus is actually on the physical therapy assistant role. And I'm really excited for this because we haven't covered this topic in any way yet in this content education series. So we've got a list of really nice questions, and Sara is really going to help us understand how taking a course or a certification program in this category through EIM can help you take your quality of patient care and your education and career, of course, to the next level. So Sara, thank you so much for joining us today.
Yeah, thanks for having me.
Why don't you go ahead and just give us a quick background or introduction, and then we'll jump into the first question.
Sure. So, like you said, I'm Sara Owens. I'm a physical therapist assistant, and I've been a physical therapist assistant for about 14 years now. I graduated in 2010, and I currently work for Professional Therapy Services in Central Illinois as a full-time clinician. On top of that, I am the PTA Ortho Certification Director for EIM's PTA Specialty Certification in Orthopedics. So that's my jam.
Awesome. Yeah, well, before we get into what that is and means and what all that entails, we always find the most people love to hear, first of all, one inspirational story about how, your work in this field really impacted or influenced or made better a patient you worked with. So why don't you share with us one of your most impactful stories to start of how, your service as a PTA helped someone?
Sure. So the patient that comes to mind was a patient who was injured doing what a lot of us might do, and that's taking down wallpaper in her house. And she repetitive motion injured her shoulder. Very painful. She worked a very high stress job, and she had a good relationship with her chiropractor, and she had imaging done, and the chiropractor looked at the imaging and thought, you know what, this is probably something that needs more of an orthopedic focus. You might need surgery. Let me send you to the orthopedic doctor. And so my patient goes to the orthopedic doctor and has a really nice meeting, but the doctor tells her, you know what, I think we're going to try physical therapy first. I don't think you'll need surgery. Okay. When she comes for physical therapy, the physical therapist and her have a really good evaluation, but that physical therapist mentioned, sometimes based on your imaging, you might need surgery. So we're going to do what we can. And the patient came for a treatment visit, and we worked on the wrong shoulder. So we have all these hiccups in this patient's care. And when I finally get to see her, she brings me into a treatment room and she shuts the door and she just starts to cry. And she's confused. She doesn't know if she needs surgery. She doesn't know why she has to have physical therapy if she needs surgery. It was just a lot. And in my role as a physical therapist assistant, I work under the direction of a PT plan of care. And part of the luxury of being a PTA is I have the time to be able to develop a little bit more of a relationship with these patients. So she and I talked a lot about shoulders, a little bit of anatomy, a little bit of pain science. I had just graduated from EIM's pain science certification, and we slowly progressed. And so using my knowledge in orthopedics, we were able to show her that sometimes imaging doesn't matter, and we really focus on function. And over the course of the next few weeks, despite her pretty significant tear, she was full function, no pain, able to do what she wanted. And she was just grateful for the chance she had to sit down, learn more about her condition and what she could do to control it on her own. So that was one patient that just really sticks in my mind that benefited from my role as a PTA because I had the time to be able to devote to her in that clinical setting at that moment.
Yeah, that's a really nice story. And that's actually one aspect of the PTA role that I didn't think about was that how you have more of that time to develop some rapport and educate the patient more. So
Right.
that's awesome. Well, so let's step back and visit, what led you or inspired you to focus on the PTA role under the physical therapy umbrella.
Yeah, so my journey was a little bit of a wild one. I originally in high school, my end goal was to be a foot and ankle surgeon. I love feet, I love ankles, I love bones. And just as I progressed through high school, and I started realizing that financially that might not make sense for me. And so my senior year, I decided that I was going to be a physical therapist because physical therapists can still treat foot and ankle pain. And as I applied to different colleges, I was accepted into an accelerated PT program, and I started to sign up for classes, and I just got a pit in my stomach, and I thought, you know what? I don't know, this college is really expensive. There was a local community college that offered the PTA role, and I thought maybe I'll just get my feet wet and make sure this is really what I want to do. And I'm really glad I did, because it's been honestly my dream job. But yeah, so I started from surgery and then ended up in as a physical therapist assistant based on just choices and thinking about what I wanted my life to be.
Nice. I've heard that story from a number of PTAs as well, that they started on a more significant, like, time requirement medical track and decided to step back, and were really happy they did. So how has integrating PTA knowledge helped you take your career and quality of patient care to the next level, especially through, the knowledge you've learned through EIM's curriculum?
Sure. So one of the benefits of being a PTA is obviously, student loans are a little bit less. And I was fortunate enough to have none when I graduated. So I was able to really invest in continuing education as I graduated. And so taking courses and just facilitating my skill set a little bit more helped me with my patients. I wasn't satisfied when I had a patient and I didn't know how to answer their questions. And as I reflected back, I realized anytime I looked at my schedule and I had a back pain patient on my schedule, I would just groan internally because I didn't really care to treat back pain. And that's what kind of drove me towards EIM. I had heard about their therapeutic pain specialist program, and I decided to go through that. And it just lit a fire in me and a new passion to strengthen some of my weaknesses and take coursework to really provide the best care. And through that TPS, I got involved more in the orthopedic realm, which obviously is where my passions lie with my foot and ankle desires. But so being a PTA and being able to focus more on the coursework, the continuing education that comes after graduation, really helped elevate my skill set.
Yeah, and you've already started to answer our next question, so I'm gonna throw a little bit of a curveball in here, because a lot of the people we have watching this content series are students, and
Yeah.
I think it would be cool to hear you explain, what you've observed in the clinic, what you experience every day, like distinguishing the PTA role from the PT role, because they're both a vital part of the overall treatment approach for a patient. And then also, why should someone consider being a PTA? And you've already mentioned, it's less costly. There's more flexibility with your specializing. There's less time required in school. I might have answered that for you just now, but can you go through those two things, the difference between PTA and PT, and then benefits of the PTA route?
Yeah. So the physical therapist assistant is always a supervised position, and we work hand in hand with physical therapists to deliver physical therapy. Part of physical therapy, as mentioned, I think in our previous next level lecture, was the importance of a therapeutic alliance. Patients are consumers of care. They're starting to want to know more. They don't like to be told what to do. And so the physical therapist's job is to start to break down those barriers, provide that good evaluation, make the patient feel comfortable. And my role as a PTA is I need to make sure I facilitate that and we help lead the patient along. At my clinic where I work, we work very closely together. It's a very open environment. We communicate back and forth about different patients because we all have different passions and different skill sets. So we work as a team and we present ourselves as a team. The physical therapist should always consult with the physical therapist, but understand too, students, when you're out and this is probably more for physical therapists, students, but when you're out and you're a new graduate, rely on those people who have experience, because years do provide experience. And while our lens as a PTA is different from a PT, we may provide some valuable insight to patients that you haven't had yet because you just haven't been out long enough. And so that's always my biggest drive for students is lean on those mentors, but look at those that have some experience because they've been out a while, and just understand scope of practice and what people are able to do and what they aren't able to do.
Very nice. Um, and then with regards to, why someone should consider being a PTA, can you review some of the benefits of taking that track versus another track, or just what I mean, not that it might not even be benefits, but what some people might value in the time save, the cost save, and whatnot?
Sure. I have always been one that not that I like group projects, but I really like working with people. And as an assistant, I'm guaranteed that I'm always going to have a team around me to work towards a patient's goals. So yes, the PTA schooling obviously is a lot less and it's cheaper, but we do have different scopes of practice. And so for somebody who's considering a PTA, it might be something where you really want to focus on treatment, not so much the evaluative side of things. We don't have as much paperwork. We do have the luxury of spending a little bit more time with our patients. And in private practice with the current reimbursement, that's a big thing. Time is valuable. And so that's something that's always spoke to me. I want the time with my patients. And as a PTA, I have the ability to have just a little bit more time, but I also work to hopefully help my PTs have more time with their patients too by taking things off their plate that's within my scope.
Yep. And it's pretty clear obviously the benefits of having the actual PT role as well, so, and then if people want to learn more about that, they can watch all of our past NextLevel episodes, because we've gone deep into that and then subcategories under PT as well, but definitely both vital roles. And I appreciate you highlighting all of that for us. So let's get into the next question. This will be more specific to actual some of the content offerings through EIM now, the certifications and course. What's it like to partake in the specialty certification course in orthopedics?
Sure. So our certification is about 7 months, and it depends on if you've taken any of the prerequisite courses, but it's a mix of faculty-led and self-guided courses. The benefit, we've created this certification with the working clinician in mind. We understand that we all have to work to afford to live, and so students are able to do the certification after work. With the self-guided courses, things are a little bit more flexible. You can kind of work at your own pace. With the faculty-led courses, there's no real true time that you have to be online together. It's asynchronous. So that allows students to complete assignments. You get the benefit of bantering back and forth with faculty to really elevate your skill set. Our certification is designed for the new graduate who just wants to learn more, but also that person who has been out a while and wants to refine their skills. I'm super impressed with all of our students. Honestly, sometimes I learn things from the students in the program because it gives us an open forum to discuss. We have a mix of PT and PTA on our faculty, which really helps us teach the learners the importance of that PT-PTA relationship and how can you facilitate a good PT-PTA relationship so your patients are better for it. But yeah, that's kind of our certification. We have the ability to have an in-person weekend intensive, but if you aren't one that can travel, we also have a virtual option too, where we take that course and we split it over 4 weeks and do it virtually.
Very cool. Awesome. Well, thank you for outlining that for us. Yeah, so I've got just one more question for you, and this is really going to force you to narrow down some of all your learnings through all the people you've talked to, all your education. With all your experience, what's one key piece of advice you give to a new PTA or someone interested in becoming a PTA?
Sure. So as I have been with EIM, I've had a lot of fantastic mentors, and one of my mentors told me the one intervention that's going to stick with our patients the longest, longer than any manual technique I apply, longer than any exercise I prescribe or modality I perform, is education. And so understanding that investing in yourself in coursework to improve your knowledge is going to benefit those patients. Patients don't want to be told what to do. They want to be told why they're doing it. So providing that sound and skillful education to our patients is only going to help outcomes. But with that too, invest in yourself. Take the courses. It doesn't matter if you're a new graduate and your CE hours don't count towards a renewal. If it's something you're interested in, take it, because that is something that can help facilitate avoidance of burnout as well.
Yeah, great advice. I think we've had a couple of other people who joined us for this cite very similar advice, as they narrow down what they would recommend. So very cool. Well, that's going to kind of round out all of our questions here, Sarah. I really think you gave some really great advice, I think, and did a great job distinguishing PTA from PT and giving people things to consider as they move forward in their careers. So all really wonderful advice. I want to encourage everyone watching right now to go on to EIM's website, obviously check out all the areas of specialization they offer, all the courses and certifications. And of course, today we covered physical therapy assistant role, but there's many, many others as well. And so is there any final words you want to leave people with before we sign off here?
Nope, if you take the certification, you're going to have a lot of fun. We've built some humor in it as well. And PTs, don't forget about those PTAs you work with. If you're going through a residency, it might be something to encourage the PTAs you work with to go through the certification to provide that same level of care you're already learning how to provide.
Perfect. Awesome. One last thing for me, I do want to encourage everyone watching to check out OPTP. Obviously, we are providers of all sorts of physical therapy equipment and accessories, and would love for you to check out our site and all the amazing products that we do offer. And if you're a professional, you can sign up as a professional and receive discounted pricing, which is a really nice benefit as well. So I'll leave you with that. Thank you everyone so much for tuning in to this next level episode with OPTP and Evidence in Motion. We'll see you next time.